There's something I've been interested in for a long time, and I imagine many of you in the McGee area have been also. We are very fortunate to have Donna, who is here and has a lot of information about dyslexia. And mostly I'm going to be asking her questions and just letting her tell you, because I don't understand it all. But I want to know first, what do you actually do? Let's put it like that.
I am considered a dyslexia therapist, and I do 1-hour therapy sessions with children who, most of them have a diagnosis of dyslexia. Some do not. That's not required.
Okay, what would make me think my child is dyslexia? What are some signs?
Well, if your child has a normal intelligence, you know that there's nothing else going on and you are still struggling with reading and spelling to the point that you keep going, why is my child not getting it?
Mm-hmm.
That's when you start thinking, there may be some signs of dyslexia. And most people think that dyslexia means I swap my letters.
Mm-hmm. That's exactly what I thought.
That's a big misconception, because you can have kids that are not dyslexic that does that, as I do.
Mm-hmm.
And then some dyslexic children don't do that. That is just almost a maturity thing that they will outgrow. But when they're spelling things phonetically the way they think they sound, that's a huge thing.
Mm-hmm.
When they're leaving off letters and leaving off endings, if it's singing and they say sing, they're actually not noticing that ing.
Mm-hmm. Mm-hmm.
So things like that when you're reading with them, that you go, why are they doing this? And then too, they can't tell you anything they've read.
Do we have any testing methods in our schools?
We do now in the state of Mississippi. There's a dyslexia screener that is screened in kindergarten and first grade. And what that is that's just an indicator, meaning that your child has characteristics that they could be dyslexic. So that's only started in the past 2 years. So if you have a third grader, I don't think your third grader would have been tested.
They could have almost missed it. So
Right.
what you're saying. So really, unless your child is kindergarten or first grade now, is when they might get caught. Is it a requirement that does Simpson County schools do it?
They have to. Every public school in the state of Mississippi they have to give the screener.
Okay. With that, do they choose which children to send for the screening?
No,
or
every student.
Every student.
Every student in kindergarten or first grade must be tested for dyslexia. Or screened, not tested, screened for dyslexia.
If you find that a child is dyslexia, what's your next step?
To seek out a psychometrist. There's several places, connections. Mississippi College has lots of psychometrists that can test. It has to come from a psychometrist or an MD.
Mm-hmm.
They have to be certified to test for dyslexia. Lots of people can do screeners. I do screeners. And when I tell people that this is only an indicator, you've got to have that. And it's very important to have that ruling of being dyslexic, because then they can put in place a 504 into the public schools that will allow accommodations to the students.
Well, and I think a lot of time people just think my child is dyslexia, not even knowing what it is.
And that is, most people don't. And it's one of these things that even with parents have to educate themselves, because there's not a lot of information out there.
No. Do you work with children at your home?
I do see private students at my home.
If we had someone in the audience that was interested in contacting you, what would they have to do? Can I just call you up and say, I think my child is this?
Well, I get calls like that all the time, and what I do is I just start trying to give them a little bit of guidance of which way to go, because like I said, they don't have to have that ruling with me because of it being a private setting. Because some kids, you just kind of know. You just kind of go, okay, I really do believe they're dyslexic, and it's not a cheap testing. It can cost anywhere from $850 to $1,000.
Oh, I had no idea.
And that's even with your insurance, because if you haven't met your deductible, that's what they're going to tell you. They can just about go through a year of therapy for the cost of getting the testing. But again, if they don't have that diagnosis, they can't take that to a public school and get the accommodations that they need, which may be, instead of having 20 spelling words, your child only has 10 spelling words. And that's a huge help, not only to the child, but to the parent that's struggling at home every night trying to help them with those spelling words.
Do you find that in other subjects that there's a problem? Or is it mainly in the English, the speech?
Well, the reading and the spelling, and now everything is reading. Even your math
And that's true.
is
That's true.
word problems. And there's such a huge problem with comprehension because they have such a hard time decoding the words, trying to read the words, that when they get done, they have no clue what they've read. So how do they really know if I'm supposed to add, subtract, multiply, or divide?
So it's almost gonna show up in every subject.
Absolutely.
Although we say reading, you've got to realize it's not like reading class.
Exactly.
It's reading all the way around.
Everything now is reading. So even a child that's dyslexic that may be strong in math, if it's a reading problem, that's going to pull them down.
So those would be signs. Is this something that you as a parent need to be checking on? Because are our schools allowed to say to this child that's in the 5th grade, I think they're dyslexic, do there may be problems, or is it really going to have to come back to parent? I guess that's what I'm saying.
It is. If you're seeing signs and you know your child is struggling and you know that they're giving it all they've got, you have to be proactive and just go after it, because you can't depend on the school system. Even if it's a private school, you can't. I mean, it's like with anything else. You have to be the voice for your child, and you're going to have to go and seek testing, because it doesn't necessarily mean that they're dyslexic. You may find out that there's something else that's causing it. So the best thing is that early diagnosis, so you can get the early intervention.
You know, it's almost scary, because I think sometimes that, often we don't want to know. We don't want to know because we don't want to accept that there might be a problem with our child. And so we will think they'll grow out of it, we'll back away from it. But I would think the earlier you were aware of this, the better.
And see, a lot of parents, a lot of things that kind of relate to dyslexia, sometimes parents kind of almost think it's cute and they don't realize that it's a problem. I mean, you know how it is when you have a toddler and they say Pusketty instead of spaghetti. Well, that sounds cute. But when they're in the 1st grade and they're still saying Pusketty, that's an indication that they're swapping letters. And see, parents will just think, oh, well, that's cute. They've been saying that for years. But it's really, it's not. Because at that point, they should be outgrowing things like that.
That's interesting, because I do think about, words that mine might have used that we always thought were kind of cute. And they really are something if they don't move out of them.
Right.
If they keep saying them.
Exactly.
All the way. Do you work with any public schools or academies anywhere in this area?
I work for Heidelberg Academy, which is in Heidelberg. I do not service any of the local schools. Now, I have been to Simpson Academy, and I screened their 1st graders in the fall. With the public schools, I don't know if I'm sure there's some kind of bylaw saying that, someone can't come in unless they're a private consultant for the district. But with a public school, they have a little bit more leeway. And Simpson was very welcoming to have someone to come in that could screen their students.
So if I think there's a problem with my child, the first thing I need to do is have the child tested, or talk to you, or talk to someone at the school, or what? I mean, number one, what am I supposed to do?
The first thing is, if you've had a conversation with the teacher, we know there's a problem, I would probably be calling. I would start, I personally would have started with my pediatrician, because I know he would know where to send us.
That's good advice.
Because,
go with your doctor first.
Yeah, because you may need a referral. A lot of insurance companies, if you don't have a referral, they're not going to accept you at some of these places. So that's probably where I would start. And if you don't have a pediatrician and you just don't know where to start, yes, they can call me, and I will give them names and phone numbers of people that I know can help them.
Well, I think that this is very interesting to me, and I think it's something that we don't realize that we have right here in Magee, Mississippi. In fact, she only lives about 2 blocks from me, and I didn't even know that Donna was right there. Give us your phone number If you give it out. Do you give it out?
I do. Just don't solicit me. 601-382-2871, and I go to bed about 9 o'clock.
So don't call me late. Don't call me late. I got it. But you know what? Be proactive with your child. I think that is probably the greatest thing that came out of all this is the necessity for you to be proactive with your child. Sometimes I can't get it out just right. I appreciate Donna coming, and if you have questions and you can't remember her number or something, you know, you can always contact me at MageeNews.com, and I'll help you get on the right path to where to go. Pay attention to your child. Listen to them. Talk to them. And the earlier the better. But it doesn't mean, because like she said, it's only been lately that we've been doing it in younger grades. So if you've got a 5th grader that's struggling, you might need to have them tested and talk with your doctor about it. Thank you for looking at MageeNews.com, and if we can help you with anything, we'll be glad to.